Today, I'm diving into an important but often overlooked topic: how the thyroid is affected during peri and postmenopause. Now, as women go through this stage of life, we're not just dealing with hot flashes and the mood swings and weight gain. We have another key player in the mix that is often overlooked, and that's our thyroid. This tiny gland has a massive impact on our energy, metabolism, and overall well being. I have been wanting to do this episode now for a while because let me tell you, ladies, I can't tell you how many times I see thyroid issues, undiagnosed thyroid issues in our group coaching members and our private patients' labs. We had a period of time there where I would say 80% of the labs I was looking at showed a sluggish thyroid. So, in this episode, I'm going to unpack how the loss of some of our key hormones like estrogen and progesterone can negatively affect thyroid function when you've never had a previous thyroid issue, making it much harder to feel our best. And sometimes we can be throwing all of these things at our body in perimenopause, like hormones, like progesterone or estrogen, testosterone, supplements, when the underlying issue could very well be thyroid, or at least thyroid could be part of this puzzle. And we really need to start watching thyroid numbers, just like we watch estrogen, progesterone, and testosterone numbers in midlife women. So, I'm going to discuss how increased midlife stress can impact it. And of course, we'll discuss the role of hormone replacement therapy and how it can help or hinder thyroid function, and just how the loss of these key hormones can really negatively impact our thyroid. So, number one, it is way more prevalent than people think. And I believe there's multiple reasons why this happens. Now, before we jump into the reasons why thyropause happens, I want to go through a list of just common hypothyroid symptoms and point out just how many of these overlap with menopausal symptoms. So, number one, fatigue, super common in menopause. Both hypothyroidism and menopause can cause persistent tiredness and low energy. Number two, which is like the most talked about, weight gain. Weight gain, of course, can happen very suddenly for women in perimenopause and menopause. As well, you can have weight gain and weight loss resistance from having a sluggish thyroid or flat out hypothyroidism. Cold intolerance. So, not common so much in menopause. We definitely have temperature dysregulation in menopause, but we tend to kind of lean more on the side of sweating and getting hot in menopause. Rather, thyroid issues tend to cause issues with being cold more often than not. Dry skin. So that's both hypothyroidism and from hormonal changes in menopause. Both can lead to dry, flaky skin. Thinning hair. Yes, hair thinning is common during both menopause and from hypothyroidism. And this is the problem is we will think it's one thing, but it could be another, could be the other, right? So estrogen loss can cause hair loss. Too much testosterone hormone replacement therapy can cause hair loss, but yet so can a sluggish thyroid. So if suddenly your thyroid starts to slow down or you develop hypothyroidism, you could start losing your hair from that as well. Depression or low mood, both very common in menopause as well in thyroid patients. constipation. Now, not as common in menopause. A lot of women will develop digestive issues in menopause, but I feel like it's more bloating, indigestion, heartburn, GERD, things like that. Rather, if you've got hypothyroidism, you will lean on the side usually of constipation. So bit of a, it's a bit different for those ones. Memory problems, brain fog, common in menopause, as well as hypothyroidism. Muscle weakness or aches, common in both. Now, irregular heavy periods, of course, very common. This is what happens in perimenopause. Our periods can get very irregular. But interestingly, thyroid issues can also impact our cycle and can cause our cycle to become irregular and can even cause infertility in women. So obviously, there's a way to kind of distinguish that, which would be if you're in your younger years and you've got all these other symptoms of hypothyroidism and you're having fertility problems because you're trying to get pregnant and you've got a dysregulated period, then you would probably move first to, do I have a thyroid problem? Rather, am I going through perimenopause or menopause? Libido. Interestingly, both can affect sex drive. Slowed heart rate. So not typical in menopause. It's more heart palpitations in menopause, but we do see some heart problems with hypothyroidism because there are T3 receptors in the heart. So thyroid function does impact heart function. High cholesterol, both of those associated with menopause and thyroid, because as your estradiol drops, we'll see cholesterol going up. And then it's a common sign of hypothyroidism is a higher cholesterol in conjunction with higher insulin levels. But yet that also can be from menopause, and the loss of estradiol can impact insulin and make us more insulin resistant. Puffy face, so like water retentive, swollen, more so a characteristic of hypothyroidism, but can be a symptom when you start HRT. So just to keep that in mind. So as you can see, some overlapping symptoms between the two. And so it's really important that when you're testing, you begin testing your hormones in midlife to figure out what's going on with your estrogen, progesterone, and testosterone, to also be doing a full thyroid panel, even though you may never have had a thyroid problem in the past, which I will also say many, many women are misdiagnosed as far as hypothyroidism goes in their fertile years. So you could have had hypothyroidism your whole life, and then it starts to become exacerbated in perimenopause and menopause. And so it's enough to go, okay, there's something else going on here, and warrants getting that full thyroid panel done. And you will not know, was this something I've always had, or is this something I just developed, unfortunately, because so many doctors do not test thyroid properly. And so you really have to kind of demand proper testing, no matter what age you are, on your thyroid. And when you're experiencing a lot of these symptoms, right? If you're checking these boxes off, mine was undiagnosed for, I bet you I've had thyroid problems since I was a teenager, possibly my whole life. I could have been born with it. I'm not sure, but it really became obvious after having my first child in my early 30s, which is really common. It's common to develop hypothyroidism after pregnancy, or worse, like it makes things worse after pregnancy, like if you had an existing thyroid problem. Many reasons for that. So safe to say, yes, these can really go hand in hand. First and foremost, I want to talk about the stress and thyroid connection because it's huge. And this goes for, of course, all ages, but perimenopausal and menopausal women typically have an increase in their stress. And I'll go into why that is. But if you have ever seen a functional practitioner about your thyroid, you'll know that the adrenal system and the thyroid, really go hand in hand and impact each other. It's a bidirectional relationship between your adrenals, the cortisol, and stress response and stress, and your thyroid. And what's interesting is, oh, I was listening, stress. Okay, number one, stress stresses me out. I don't know about you guys, but stress is stressful. And it's something that I'm really trying to manage myself. And I've been trying all these different tactics and devices this year to really try to rein in the stress and get better control of it, because I know as a practitioner the impact of stress and how it's number one when it comes to any disease that you have and getting to the root of the problem. One of the number one things you can do for anything is manage stress. And I was listening to this podcast just this weekend. It was on the Dutch podcast, which it's an okay podcast. Some people would probably find it really boring, but if you're interested in kind of the science behind hormones and things like that, it's definitely, if you're a practitioner or you just want that deeper dive, it can be where some of their episodes are really good. So this episode was all about the gut microbiome and stress. And I'm just going to point this out, just the importance of managing stress. So the guest talked about a study done in 2015 where there was a publication in a journal called The Frontiers of Immunology. And this was a meta-analysis paper at that time that had reviewed a number of papers that fit within this topic. And they concluded that stress-induced intestinal permeability was the number one cause of mortality and morbidity worldwide. That's crazy. That means stress-induced leaky gut. They went all through all the pathology and pathways and how all that disrupts the microbiome and causes disease. That was the number one killer worldwide because it is at the root cause of diabetes, heart disease, obesity, cancers, autoimmune conditions, you name it. They were able to connect the pathologies and pathway to all of those disease states. So stress is one of the most potent drivers of dysbiosis in the gut. And it's also one of the most potent drivers then of eventual leaky gut or intestinal permeability. And guess where we convert a lot of our T4 to T3, our active thyroid hormone? You guessed it, in the gut. So if your gut's not doing well, your thyroid might not be doing well. And guess what? When we lose estrogen and progesterone, we can have gut issues. And really, who doesn't have gut issues? I think everybody's got gut issues. I've got a really good podcast coming out on Tuesday all about the health of our gut and the impact it has on our brain and other processes in our body, like hormone metabolism. So definitely tune into that one. But it is like, we've all got some degree, I think, of leaky gut because of our environment, because of our stress, because of the toxins in the food. So this can, of course, really impact that. You can listen to that episode. It's called Stress versus Gut Health, Mastering Microbiome Balance. And that was on the Dutch podcast. So stress and thyroid function. It's well known that stress and stress hormones like cortisol can negatively impact our thyroid function. Cortisol, being the primary stress hormone, plays a significant role in regulating thyroid function, and chronic high cortisol levels can negatively impact the thyroid in several ways. Number one, Elevated cortisol levels can interfere with the hypothalamus pituitary thyroid axis, the system that regulates thyroid hormone production. When you're under chronic stress, high cortisol can reduce the release of thyroid stimulating hormone from the pituitary gland, which in turn decreases the production of T3 and T4 hormones by the thyroid. This can lead to lower overall thyroid function and, of course, hypothyroidism. Cortisol can impair the conversion of that T4, the inactive form of thyroid hormone, to T3, the active form. This means that even if your thyroid is producing enough T4, high cortisol can reduce the amount of available T3, leading to sluggish metabolism, fatigue, and other hypothyroid like symptoms. High cortisol levels can also increase the production of reverse T3, an inactive form of T3. It's like the brakes on your metabolism. Not fun. I had a very elevated reverse T3 at one point in my life, and I got very overweight, heaviest I ever was, and felt like absolute garbage. So it's not something to be disregarded, that reverse T3, which no doctors test reverse T3. It's ridiculous. At least not, there's not even a lab in Canada that tests reverse T3, which to me is insane. And come on, people, we're in 2024. Why is it that we still do not know how to treat and test thyroid function? Blows my mind. Anyways, reverse T3 binds to thyroid receptors without activating them, essentially blocking T3, the active form, from doing its job. This can make it difficult for your body to use thyroid hormones properly, further exacerbating thyroid dysfunction. Chronic stress and elevated cortisol can weaken the immune system, potentially leading to autoimmune thyroid conditions like Hashimoto's thyroiditis. High cortisol levels alter immune function and may trigger or worsen autoimmune responses, which can attack the thyroid and impair its ability to function. Disruption of thyroid hormone receptors. So, cortisol can interfere with how thyroid hormones bind to their receptors on cells, even if T3 is present. So, you could look like you have great T3 levels, but high cortisol can make cells less responsive to thyroid hormones, essentially making it harder for the body to read the signals from the thyroid. Since thyroid hormones regulate metabolism and energy, high cortisol levels can slow down the metabolic rate. This often leads to weight gain, particularly around the abdomen, which is a hallmark symptom of both hypothyroidism, insulin resistance, which go hand in hand with thyroid, and chronic stress. Now, here's the thing, ladies. As we go through perimenopause and menopause, it is well known that our stress levels go up and our tolerance to stressors goes down. Women will often say to me that they feel like their stress is so much higher now than ever before, and that they simply can't handle things like they used to. Now, I could do a whole episode on stressopause, stress pause, but I will just mention a few key factors here. The transition into menopause can be a pretty stressful time for many women. Research shows that the sleep disruptions and lack of quality rest that come with menopause can send stress levels soaring. On top of that, several studies have found that the symptoms of menopause can seriously impact mental health and even affect a woman's financial situation, adding yet another layer of stress. So it's not just the hot flashes and mood swings, it's the whole life shift that can really take its toll. During menopause, of course, estrogen levels drop significantly, which can lead to a rise in cortisol. Estrogen helps regulate cortisol, so when estrogen declines, cortisol can become more elevated. Several studies support this, showing that women in the late stages of the menopausal transition tend to have higher cortisol levels. This increase in cortisol can contribute to many of the common symptoms of menopause, like anxiety, sleep issues, weight gain, and mood swings, further compounding the stress of this life stage. Now, estrogen affects cortisol levels and their regulation in a few key ways. Estrogen increases the production of something called your cortisol binding globulin in the liver, CBG. CBG binds to cortisol in the bloodstream, making it inactive, just like SHBG. So we have all these different binding globulins. SHBG, sex hormone binding globulin, it's going to bind to testosterone, dihydrotestosterone, and estradiol. And then we've got cortisol binding globulin uh, that will bind to your cortisol as well as to progesterone. So when estrogen levels are high, more cortisol is bound and inactive, reducing the amount of free active cortisol available. Conversely, when estrogen levels drop as they do during menopause, CBG levels also decrease, leading to an increase in free active cortisol. Now, this could be okay, but if you're stressed out and you're producing a lot of cortisol already, now you're unbinding this cortisol, and so that it's all wreaking havoc all over your system. Estrogen plays a role in regulating the HPA axis, which controls cortisol production. Low estrogen levels can disrupt this regulation, potentially leading to higher cortisol levels and increased stress responses. Estrogen influences how the body responds to stress. Lower estrogen levels can affect the body's ability to manage stress effectively, potentially leading to elevated cortisol levels as the body compensates for the stress response. So you can see here that estrogen has a lot to do with how we handle stress and how our bodies regulate it. Now, progesterone also plays a significant role in managing stress and regulating cortisol levels, particularly in midlife women. Progesterone has a calming effect on the nervous system because of how it acts on the GABA receptors in the brain and can help counteract the effects of cortisol. I always say as progesterone goes down, cortisol and stress go up because we no longer have this beautiful buffer of progesterone that can help mitigate the stress response by being nice and calming and can also help you sleep. And if you don't sleep, cortisol goes up, blah, blah, it's this vicious circle. It's been shown to compete, this progesterone has been shown to compete with cortisol for binding sites in the brain, which can help modulate the stress response. When progesterone levels are adequate, it can help maintain this beautiful balance between cortisol and other stress hormones. Progesterone influences the body's stress response by promoting relaxation and reducing anxiety. It acts on those GABA receptors, which have calming effect and help counteract the how the stimulatory effects of stress hormones like cortisol. So it can help counterbalance that. As women transition through menopause, progesterone levels decline significantly. This drop can reduce the hormone's ability to balance cortisol and manage stress effectively. The resulting imbalance can lead to heightened stress responses, increased anxiety, and potentially higher cortisol levels. Now, I want to highlight this another fascinating study that looked at the connection between stress and thyroid function in women. The study focused on 114 working women aged 20 to 49 with no history of thyroid disease. The researchers aimed to see if chronic stress, a huge factor for many women, could influence thyroid health. Here's the breakdown. They use the perceived stress scale to measure stress levels and analyze thyroid hormones T3, T4, and TSH. It's really too bad that they didn't put reverse T3 in there. Interestingly, the study found that while there was a positive correlation between stress and TSH levels, it wasn't statistically significant. However, they did observe occurrence of subclinical hypothyroidism. So, subclinical is kind of what maybe a functional medicine practitioner would say is hypothyroidism, but maybe a medical practitioner would just say, "Oh, your thyroid's, suboptimal because you're at, towards the bottom of the range." But they wouldn't warrant that as something that would need medication or treatment, and they would just say, "Oh, you're okay. It's subclinical hypothyroidism." So they did find a higher occurrence of this, subpar thyroid function. Other factors like age, BMI, and get this, the length of married life also played a role in increased TSH. So that's thyroid stimulating hormone. We don't want it to go up. The higher TSH goes, that means the harder it's working to get your body, your thyroid gland, to produce thyroid hormones. So the length of your marriage played a role in increased TSH and subclinical hypothyroidism. So the takeaway here, ladies, is stress does seem to have an impact on thyroid function. And when combined with factors like aging, the length of your marriage, your dropping estrogen and progesterone, and lifestyle can lead to thyroid issues like hypothyroidism in menopause. I think like I'd like to know more about that. They didn't elaborate. It's like so people or women like the longer we stay in a marriage, the more likely we are to have a thyroid problem. Like what is that? So, is it the same if your marriage quality is good? Like and then I have to that leads me to kinda go down that rabbit hole of the energetic piece of hypothyroidism. So, we know that women it's far more common for women to develop hypothyroidism and far more common for us to develop it as we age. Your thyroid, where it is in the body, is where your voice chakra is. And so in the woo woo world, they'll say that part of the reason why you may have hypothyroidism or thyroid issues is because you're a person that doesn't speak your mind very often, or you don't speak up. It's like, here's all the things that you wanted to say and you never did. And that eventually can become stagnant energy in your voice chakra, which then can lead to hypothyroidism. I really believe in stuff like that. The mind body connection, it's absolutely a true thing. So I think that it's just to me, it's just interesting. It's like, the longer you stay in a marriage, is this because you aren't expressing how you really feel in that marriage? And, it's like built up over time that it just gets worse and worse. Who knows, ladies? Who knows? But it's just something to think about. Now, please don't everybody just go leave their partners because they have a thyroid problem. They're like, oh, we've got to get divorced because I have hypothyroidism and I need to get to the root cause. Please don't do that. Okay. Now let's talk about so there's your stress piece. So you can see that just general stress, no matter what age you are, is going to impact your thyroid. But now it's compounded as we age because our stress tolerance becomes less because of the loss of our hormone, these other hormones that act like buffers to stress. So we have like kind of these kind of synergistic things that are going on back and forth with your thyroid and your ovaries and your adrenal system, and they all work together. And so all of this, of course, can impact thyroid function and make stress worse, which then can worsen the thyroid function, how your thyroid's functioning. Now, let's talk about the synergy between estrogen, progesterone, and testosterone and your thyroid. So, estrogen first, and we're going to talk about estradiol being the most important of your hormones that hit the road in menopause. We produce majority of it in our ovaries. There's other through conversions we can do as well, but estradiol, this is interesting. So, estradiol can have negative and positive effects on thyroid. It influences thyroid function by affecting the production of thyroid hormones. It can enhance the production of thyroid binding globulin. So there's another binding globulin, so TBG, thyroid binding globulin, binds thyroid hormones in the bloodstream, making them inactive. This can lead to higher total levels of thyroid hormones measured in blood tests, which could potentially then decrease free thyroid levels. And you'll hear this, possibly. You'll hear people say, oh, estrogen can cause hypothyroidism or sluggish thyroid. But what's interesting is when you start to read through the papers and the research shows on some of these papers that free levels are unchanged, even when TBG goes up, which doesn't really make a lot of sense because you would think, okay, well, if thyroid binding globulin it's going up and binding up more of our free thyroid hormones, would that not leave us with less free thyroid hormones? You would think so. It's just that some of the research is saying that the free levels were unaffected, even though TBG did go up. Weird, I know, but that's just what it showed. But where a lot of this stems from, and I think this is where it gets confusing for people and kind of misinterpreted, and people will say, oh, estrogen causes thyroid binding globulin to go up. But a lot of that research is showing that that is oral estrogens. And that can be from birth control pills, bioidentical oral estrogen, or old school classic Premarin estrogen, which is oral estrogen, old estrogen HRT. All of those like hands down shows in the research raises thyroid binding globulin. So, and you'll find this with many of the binding globulins, that they'll go one way or the other, which I think is very interesting. So when you take things like testosterone orally, estradiol orally, it can raise thyroid binding globulin. But if you take certain anabolic steroids like oxandrolone, it can lower sex hormone binding globulin. And so there's these like, to me, it's just strange because, and maybe I need to go back and take some more biology and science classes to really wrap my head around the binding globulins. But some of them raise, like some of these hormones, whether they're synthetic, anabolic, birth controls, things like this, can raise them, or it can deplete them, the binding globulins. Oxandrolone as well can lower cortisol binding globulin too. So, or no, other way around. I think it goes up because it can lower cortisol, free cortisol level. So it can go up. So yeah, so just these different strange effects that happen through the liver with these different hormones that can make these binding globulins go up or down. So what the research shows very clearly is that oral estrogens of any kind, synthetic, bioidentical, horse-derived, can increase this thyroid binding globulin and decrease free levels of thyroid hormones. Not good. So Now I have like I interviewed Dr. Kyle Gillette. I've also spoken with many like really, really smart hormone practitioners who have also who have told me that some like if levels get too high of transdermal estradiol through the skin can eventually raise thyroid binding globulin. But this one paper that I was reading, and I've seen it before several times, is that based in the research, it showed that transdermal estradiol did not raise thyroid binding globulin. Yet there's some practitioners saying that it can. So I think bottom line is we just obviously, if we're going to be using estrogen of any kind, we want to be watching thyroid levels, free T3 and free T4 specifically. Okay, so positively, estradiol can affect the sensitivity of thyroid hormone receptors. Higher levels of estradiol may increase receptor sensitivity to thyroid hormones, which can enhance the physiological effects of these hormones. I thought that was very interesting. Estrogen has been linked to the modulation of immune system responses, which can influence autoimmune thyroid conditions such as Hashimoto's thyroiditis. Elevated estrogen levels, such as those during pregnancy or with hormone replacement therapy, can impact the autoimmune response and potentially affect thyroid function. Estradiol affects the hypothalamic pituitary thyroid axis, which regulates thyroid hormone production. By influencing the HPT axis, estradiol can indirectly affect thyroid function and hormone levels. This was so interesting. In one study, I found using ovary ectomized, so rats. So these are rats that have had their ovaries taken out, ovarectomized. um, a model for menopause. Okay, so that's what they'll do to rats to test things like like making them menopausal. Basically, they're making them menopausal, and then they can test things for them. Researchers found that low estrogen levels led to decreased thyroid hormone levels and increased thyroid stimulating hormone, which isn't good, right? We want our T4 and T3 to be up, but we want TSH to be down and reverse T3 to be down. So, this study suggests that estrogen withdrawal can reduce thyroid function. Interestingly, when these rats were treated with estradiol, the best form of estrogen, their thyroid glands showed signs of increased activity and growth, including changes in the structure of thyroid cells. These findings suggest that while low estrogen can reduce thyroid function, estrogen replacement may stimulate the thyroid. This highlights the need for careful monitoring of thyroid health in women undergoing estrogen therapy to balance the benefits and risks effectively. So there's some mixed research there, as you can see, but I think it's pretty positive showing that as long as we're not taking that estrogen orally and we're not getting too much estrogen, that it is going to support our thyroid function, not hinder it, which, yeah, I think it's just so interesting. I was really happy to find that study actually. Progesterone. So progesterone is often talked about when it comes to how does it affect thyroid, because it does very positively influence thyroid function in several ways. And then during perimenopause and menopause, because it's kind of one of the first hormones to say, see ya, it can really start to affect your thyroid health. Progesterone helps balance the estrogen levels in the body. When progesterone levels are adequate, it can support the proper functioning of the thyroid gland. A drop in progesterone could lead to an imbalance in that estrogen, which could make you be estrogen dominant if you're producing lots of estrogen and no progesterone. Now we have this abundance of estrogen, possibly too much, which, as I said before, could raise thyroid binding globulin. So, progesterone is always needed to counterbalance estrogen. Um, Super important. And also, it helps with each other's receptor. Estrogen helps with progesterone receptors, progesterone helps with estrogen receptors. They really need each other. So, that can impact the thyroid as your progesterone starts to drop. Progesterone has been shown to impact thyroid hormone receptor sensitivity as well. Adequate levels of progesterone can enhance the effectiveness of thyroid hormones in the body. A decrease in progesterone might reduce receptor sensitivity, potentially affecting thyroid function. Progesterone plays a role in metabolism and energy regulation. Lower levels of progesterone could lead to a slower metabolism, which may compound issues with thyroid function, particularly if thyroid hormone levels are already low. And then, as we discussed earlier, progesterone helps modulate the body's response to stress. As progesterone levels drop, stress levels might increase, leading to higher cortisol levels. Elevated cortisol can negatively impact thyroid function, potentially exacerbating thyroid issues. Now, I hear often about progesterone's impact on T4 to T3 conversion. But unfortunately, there is very little research to support that. I think it's more clinical experience that this has been seen, that when women start to use progesterone, they see better conversion between T4 and T3. I just noticed that, yeah, progesterone just in general can help support thyroid function, and I do see it helping. So I think that it can influence that T4 to T3 conversion, but as I said, no research to support it. Okay. Now, testosterone, not hugely, um, it doesn't hugely affect thyroid, probably more so in men, is my guess, than women. But there is some evidence that shows that it does have an impact, and testosterone can increase the T3 T4 ratios, which probably reflects higher T4 to that T3 conversion. Um, okay, also research showed that individuals with low testosterone who are given testosterone therapy show a decrease in thyroid autoimmunity antibodies. This correlates to testosterone therapy being potentially protective in those with Hashimoto's thyroid autoimmune conditions. Isn't that interesting? I did not know that. And it didn't explain why they like why does that happen? It just that one paper showed was that, yeah, there was this correlation. And then and that's all I could find with testosterone. But once again, clinical experience has shown that when you get a woman's testosterone levels back up, if they were really low, that it can affect your T4 to T3 conversion and just overall help to support thyroid function. Not in everybody, but we have seen that clinically. Uh, with the Hashimoto side of things, the antibodies, it is very common for autoimmune conditions to be triggered. It's like you get this, it's a genetic switch, right? So you may have that switch turned off your whole life, and then you start to go through perimenopause and menopause. And because of the added stress on the body, the gut dysbiosis, inflammation, maybe poor diet, insulin resistance, that switch can get flipped on. And so we do see an increase in Hashimoto's thyroiditis cases in midlife women. So this is, I think, just that combined, like it's the epigenetic scenario of all of these things compiling that flip these switches on. And we'll see it in other autoimmune conditions as well that are get flipped on in midlife. And even like you have to remember our gut is like our it's immune system in the gut. And so if your thyroid, I'm sorry, your estrogen goes down, your progesterone goes down, that can affect your gut. And then now your T4 to T3 isn't working so well. Now you've got dysbiosis in the gut, which then causes inflammation, which then can trigger Hashimoto's. Like it's just like this goes on and on. And everything's connected with each other and back and forth. And so we have so many things coming at us in midlife, and thyroid just has to be one of those things that we've got to monitor. It has to be added to this mix. You know, we talk so much about estrogen, progesterone, testosterone. We've got to start including thyroid in this conversation because it's super prevalent. So when it comes to, you know, the effects of course, replacing these very important hormones, estrogen, progesterone, testosterone, you can, from everything that I've told you here today, that's, you know, we know that by replacing estradiol, they see an increased in rats, but they see an increased function in their thyroid. Uh, so if you replace your hormones as you are going through midlife, so as you're going through perimenopause and you start checking these hormones and you're where everything's at and how you're feeling, and you are topping up these hormones as you go on through perimenopause so that you don't suddenly, you know, the bottom doesn't fall out, then your thyroid could be really helped by that, I think. You know, obviously not by for everybody, but I do think that it has such a large impact, as we've heard here today, on thyroid function, that topping up and keeping those levels at good levels, you know, optimized levels for you, could very well keep the thyroid functioning properly. Sometimes it won't though, and we see this. So in our practice, what we tend to do is, because we see this so often, and honestly, like I went for a period of several months this year where it was like every lab I looked at in our group coaching calls and in my private clientele with my private clients, there was a T4 to T3 conversion problem. It was like everybody's T3 was at the very bottom or under range. Their T4 was normal. Their TSH was normal. I was like, what is going on? And it was like the universe going, you got to look at this, Karen. You got to talk about this. This has to be, you know, this is something. This is what happens in perimenopause and menopause for women, for a lot of women, and a lot more than what the research is telling us as well, because it's so often missed and misdiagnosed. Uh, so, you know, seeing it so often, and I mean, it was really just for that chunk of period of time. I think generally I would say 50% probably of I know, a little bit more than that. We'll say 60% of labs in midlife women that I look at, whether it's perimenopause or menopause, about 60% all see a sluggish thyroid. Sometimes we'll go through times like I did where it's a lot higher than that. And then there'll be times where it's lower. But it is definitely a problem, and it seems to be more and more so, possibly, maybe just because we're properly testing more now, but uh, we see it being, what's most common is we see that T3 being towards the bottom of the range. And so what we'll do is we optimize the woman's other hormones first. So unless it's like, if she's rock bottom or under range and she's complaining of the symptoms, like she's tired and she just cannot lose the weight, she's gaining lots of weight, maybe she's got a history of symptoms of hypothyroidism, but it's never been diagnosed, then we'll of course, be like, okay, I think you need a little bit of thyroid medication while we figure out maybe the root cause of why your thyroid's not functioning properly. And some people they'll never get to the root cause. It's something that they've maybe had their whole life and never knew, or it's just it was passed down. It's genetics. There's so many different causes. Some things are really hard also to get to the root of. Heavy metals have massive impact on thyroid, and that can take a really long time. The metals can take a long time to get rid of. Mold toxicity, super prevalent, also can affect thyroid function. Genetics, inflammation, I mean, the list goes on, the root causes for thyroid. So energetic, you're not saying what you need to say. So many different reasons. And some women just don't get to the bottom, don't get to the root cause. And we really believe in our practice that a woman needs to feel well to get to the root of the problem. So a lot of doctors, a lot of functional doctors, and I'm not slamming functional doctors, they're amazing. I know they're great, but I do find that a lot of them will say, well, we just need to fix your adrenals and then your thyroid will be fixed. Or we just need to get to the root of the problem. Don't take the medication because we need to get to the root of why you have thyroid problems. Why is your thyroid doing this? That's great. I understand where they're coming from. They're coming from a place of functional, get to the root problem from that scope of practice. Great. But sometimes a woman just needs to feel better in order to do what needs to be done in order to get to the root of the problem. Also, what if she's had this her whole life? What if she can't figure out the root cause? Are we going to make her go the rest of her life suboptimal, overweight, tired, have exercise intolerance, thinning hair, dry skin, cold? Like, that's not a nice place to be in. I've worked with so many thyroid patients. I just had one recently who she kept saying, I just want to get to the root of the problem. I don't want to take thyroid medication. And we've suspected that we've known she's had a thyroid problem for years. I've worked with her for years and she's always hesitant, but she just went through some tough things. She had another mold exposure and her thyroid went down even farther. And she's gained a bunch of weight and she's super depressed and she can't exercise and she's beating herself up daily. She was in tears constantly, just super emotional and just felt really terrible about herself. And I just finally said to her, like, y- maybe you'll never get to the root of the problem. And if you don't, you want to feel this way forever, and it's okay to take medication for these things. Like it's not a bad thing. And I understand that, I'm one for getting to the root cause, but I'm also one for women feeling well. And if that can give her a leg up so that then she can get rid of the mold and do all these things and then try and come off her thyroid medication, great. Do something like that. Uh, anyways, long story short, ladies, she ended up going on thyroid medication. And within 2 days, she messaged me to say she couldn't believe how much energy she had. She was skipping. She's like, I was skipping. She's like, I can't even believe this. I was like, yeah. And she's like, and my bowels are working and I'm not depressed. I'm not crying. I joined Pilates. I'm like, oh my gosh, like this is all in 1 week of being on thyroid medication. It's like, look at how long you fought it for. And look at how good you could be feeling. And now she's got the tools to go out there and figure out the mold and other things, right? Personally, I went on thyroid medication for several years while dealing with my heavy metals. I've been slowly chelating the heavy metals. And I have been able to I've dropped my thyroid medication more than half of what it was. And so I've been slowly able to start weaning down on the thyroid medication and doing really well. And I watched on my labs, my thyroid function going up, 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 up from all of these interventions that I've been doing. taking different supplements and, just getting rid of the heavy metals. Boom, 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 thyroid's coming up. And so I'm going to be able to come off, I would think, or at least wave like to microdose, basically, if any, of thyroid medication. So, point being is, some women do need medication and they need it right away because we want you to feel well. We want you to have the energy to get better. We want you pooping every day. We want you to exercise. We want you to lift weights and, go for a walk. And if you're super hypo, that can't happen. We want you to be happy. Depression is a huge, huge, very, very common symptom of hypothyroidism, as well as menopause, of course. So you've got both of these coming at you. This can be really a tough time if you're not being treated properly. So there is a time and a place for medication that needs to happen maybe right away for some people. And then for others, and for many of our patients, we start with optimizing those other hormones. And then in 3 months, we look and see what's your thyroid done in 3 months now that we've got these other hormones up. And if we start to see an improvement in thyroid function, we don't touch it. And we just continue to check labs, make sure that thyroid's going to come up, maybe support it with some great thyroid supplements from Dr. Amy, my thyroid girl, my thyroid gal. She's got great products for thyroid function. So we'll put them on something to support their thyroid. And that can be all that is needed. Maybe some nice thyroid glandulars, some T2 from Amy. There's lots of things that they can do, plus getting the other hormones up. And lo and behold, in 3 to 6 months, we see the improvement in their thyroid function. And so that is typically where we like to start with when it's that subclinical, suboptimal thyroid function that could be from just the drop of those other hormones. And so typically that's what we do in our practice and with our group coaching ladies. And we'll tell them like, hey, this is what we think you should do first and foremost is maybe just like, let's optimize your other hormones and see what happens, because it so often works really, really well to just optimize them with HRT of estradiol, progesterone, and testosterone if we don't have to go to the thyroid. But like I said before, some women do need to start replacing thyroid at perimenopause and menopausal years, because bringing up those other hormones doesn't affect, unfortunately, the thyroid. And then in which case, we want you to have an optimized thyroid as well. And so we'll start to replace your thyroid with thyroid medication, which is, it's bioidentical. It's coming. We use things like Armor. Um, we use T3, T3 only for some women if they have a high reverse T3. Sometimes just a little microdose of T3 can just work wonders on women. Like 15 micrograms of T3, just to bring down that reverse T3 can help bring up the metabolism, help them to feel better, help their bowels to get moving, things like that. So keep that in mind, ladies. Please, number one, go get tested properly. We want to watch those thyroid, all the sex hormones, but we also want to watch your thyroid hormones. So you're looking at TSH, free T4, free T3, reverse T3, thyroid peroxidase, which is TPO on the labs, and thyroid binding globulin, TGA. Those are your two antibodies that you're testing to see if there's any autoimmune, like Hashimoto's thyroiditis going on. Really important. Our new lab list. So if you can't get your doctor to do it, we have now been going through another company, and we are able to do all of your labs, all of like the CBC, your CBC panel, your lipid panel, your blood sugar, so many different markers, all of the hormones, estradiol, progesterone, testosterone, dihydrotestosterone, I think even pregnenolone's in there. And then all of those thyroid markers that I just said are in there for $249. So we can order all of those for you if you're in the States. If you're in Canada, It's even cheaper. If you're in British Columbia or Alberta, we can order labs. It's $30 for the panel, but usually in Canada, you have to pay out of pocket for T4, T3, and reverse T3, and possibly even TPO and TGA. So then it starts to go up, and it's usually like $30 for each of those. So um, you could start at least with the free T3, like pay out of pocket for free T3, free T4. The rest, like the TSH, is covered. There's like, so that's an extra $60 for those ones. Reverse T3 might be, I know, I think reverse T3 is $30 too. So you could do, but you could just simply start with free T4 and free T3, because by looking at those a lot of the time we can see sometimes if there's a suspected elevated reverse T3, because if T4 is normal but T3 is really low, that's usually telling us then that your reverse T3 is going to be elevated. Then you could then afterwards go, okay, I want to see what my reverse T3 is, as well as my antibodies. So I know what kind of thyroid issues I have. So then you'll be able to identify, is it a conversion problem or is it an autoimmune problem? And then you can start to get to the root of the cause of the thyroid problems. Okay, ladies, that is it for today on Thyropause. I finally did this episode. I'm so glad because we need to know this. Women need to know that thyroid is just as important. We've got thyroid receptors all over our body. It has so much to do with how everything functions. We need it. So, very important. Thanks for tuning in once again, ladies, and we will see you same place, same time next week.